Hello and welcome back to my channel. Today's topic is a pretty hot one. Well, not really that hot, but for mamas to be who are currently pregnant or planning a pregnancy or have had a baby and thinking about another one, or just generally interested in what the hell happened to them during pregnancy. We're talking about diastasis recti or abdominal separation. I've had a lady email me about how do I prevent abdominal separation. She works really hard in the gym. She's previously been a gym junkie prior to getting pregnant. She's pregnant now in her second trimester. She's starting to notice that maybe she's getting separation and she wants to know what can she do to stop it. And that made me think I'm going to make a video on this because I actually hear this a lot with what did I do wrong during my pregnancy to get my diastasis recti so bad, or how can I stop it, or like just generally knowing how to rehab it after. So what I'm going to tell you today is really important because lots of women are misconceived about this and there's really not that much research about it that proves anything just yet. And there's a lot of stuff on social media that is misconceiving and wrong. And I would really like to just help women know what's right. So can you prevent diastasis recti from actually happening during your pregnancy? The answer is generally no. 100% of women actually get diastasis recti or abdominal separation during their third trimester. So basically, if you don't know what it is, it's your abdominal muscles or your six-pack muscles have like 1, 2, 3, 1, 2, 3, have this little bit of tissue in between them holding them together. And when your baby grows, that little bit of tissue stretches apart so that it makes space for your baby. So it's the tissues in between the two six-pack muscles, or two sides of the six-pack, that stretch. Now, it's going to happen during your third trimester, and if it doesn't happen, then your baby's got no space in there and it's not going to be that great anyway. So it has to happen. You'll actually notice that at the time it's not really that obvious, but it's only really obvious during your postpartum period. And this is when you'll know how well or not your tissues will recoil. So you really only get that separation, like it's not really problematic, until after postpartum when they haven't come back together. So some ladies get like ridiculous separation, like 4 centimeters, 5 centimeters, like big, like the gap is big. But we also have to measure on how, what we call the tissue integrity. So how deep can you push your fingers into that gap, and does it actually feel really squishy and soft, or is it actually quite hard? So the distance and the integrity is what's really important about your diastasis recti. I'd also really like to highlight right now that if you look up a bodybuilding photo of a male, really big guy, they can actually have diastasis recti as well, because they've got so much loading through the tissue in their abdominal muscles when they train that it actually separates as well. And then that causes them to have the same problem. So there you go. Not just women get this. But what we're going to talk about is during your postpartum period, that is when you will notice how much diastasis you have and whether or not your tissue has recoiled properly. So some women actually get a recoil, comes back together and they have no problems, and great for them, happy. But for those of you that don't get that and you're worried about having your second baby or your third baby or another one or whatever number you're up to, just know that there's nothing you can really do that's going to prevent it from happening. However, I do always give advice to women that it's really important in the postpartum period that you do your core work correctly. So if you can establish what your core work is postpartum or during your pregnancy or pre-pregnancy, whatever you want to call it, then you're going to have a really good connection with how to switch your core on properly, how to do your pelvic floor exercises properly, and how to bring that separation back together safely and effectively with the right exercises before it happens, if that makes sense. So you'll know what to do after in your postpartum period. So your number one tip is go and learn how to turn on your TA or your transverse abdominis muscle properly. So that's what you want to really focus on, because that muscle, which is like the corset, I've explained this in a couple of other videos, but if you're not sure about the anatomy, there's an anatomy video on, I think it's in the incontinence video. It's like a corset and it wraps around, and when you tension it, it pulls together. So that's going to help pull the tissues back together of your linea alba, because that actually inserts into the TA muscle as well. So if you're doing TA work, it's going to help draw the six-pack muscles back together. That being said, sometimes the gap doesn't actually come back together all the way, and that isn't actually the biggest problem. Maybe the only issue for you is that you don't like the look of it. However, if the tissue integrity, which is how far you can push your fingers in, is really strong and your core functions properly, then that's actually not a bad thing. So for function and movement wise and safety and future pregnancies and all that stuff, but it's mostly just an aesthetics thing. So if you just don't like the look of the gap, then that's when there's an issue. But if it doesn't come fully back together and your core function's okay and you're okay with that, that's totally fine. Totally fine. So in your pregnancy, doing the correct core work in order to learn how to do it, and well, not learn how to do it, but do it properly again in your postpartum period or continuing it on, would be really, really important. And learning how to do your pelvic floor problems, because learning how to do your pelvic floor exercises is what I actually meant. But pelvic floor and TA work together, and in the postpartum period, if your abdominals have separated and that system isn't functioning very well, it could actually affect your pelvic floor. Even if you're not having those signs and symptoms, working those all together properly is also really beneficial in terms of the gap after the pregnancy or in the postpartum period. The other point that I wanted to make was a lot of women think about doing all of their core work in the postpartum period, like crunches and planking and oblique twists, and often a lot of those can cause you lots and lots of problems. So in the third trimester of most women, if they've got really big concerns about their separation, they don't want to do anything, I really kind of eliminate any oblique work, because your obliques also insert into that linea alba, which is that middle of the tissue. And if you do too much of that, they're going to tense and pull on the linea alba and make that separation worse, especially if you're doing that in the postpartum period and you're doing heaps of oblique work and the gap's getting bigger, cut them out. However, whether it affects it during pregnancy, there's not a whole bunch of research, but I just think, if you're suffering from really worrying about it, then I'm just going to cut them out, because let's just do what you feel like is going to keep you safe. That's what my goals are for a lot of my clients. So yeah, if you are worried about your separation and you're currently pregnant, just know that it's 100% okay and it's going to happen, and it's the postpartum period that you can work on in order to bring them back together. And the sooner that you kind of get onto all of that stuff in a safe and gentle way postpartum, then you will be pretty okay at getting it back together in most scenarios. However, if it's really severe, then you will be beneficial going to seek medical and professional advice and not trying to fix it yourself. Just know that during pregnancy, it's going to be okay and it has to happen. So don't worry about it too much, and worry about it a little bit more in the postpartum period when you can actually do something about it. Until then, happy training, and just remember, do core work and do it properly. Otherwise, I hope you have a great day, and I hope this video has helped, and I'll see you in the next one. Bye!